and welcome to this edition of Northwest Newsweek. The number of confirmed cases of COVID-19 in northwestern Ontario has risen to 12, with 4 of those cases residing in a community on the North Shore. The Thunder Bay District Health Unit reports that the first was a woman from Nipigon who tested positive for the virus following a trip to the Maritimes. She and her family members have been self-isolating ever since they returned home, but the health unit is now reaching out to people on that same flight. Corey Nordstrom has more.
On Tuesday, it was confirmed that a woman from Nipigon tested positive for COVID-19, and because of recent air travel, the Thunder Bay District Health Unit put a call out to travelers. The woman had flown on Porter Flight 222 from Halifax to Thunder Bay on March 19th, with stops in both Ottawa and Toronto. Health unit officials say anyone in rows 8 through 12 of that flight were in the transmission area.
For individuals within several rows around where an individual is sitting, they have it's called a moderate potential for exposure, but the rest of the cabin, unless there was a direct sort of interaction of more than, for example, 15 minutes, they would be considered at a low risk for exposures.
Passengers in those rows, including flight crew, should self-monitor until April 2nd and contact the health unit if they developed symptoms. DeMille breaks down the follow-up process when someone is tested positive for COVID-19, first starting with their schedule and determining their infectious period.
If you were out in the community, did somebody come to your house, somebody coming in? And we're really trying to identify people that they might have come into contact to, come in close proximity to them during the time that they were infectious. And then we get the names of those individuals, and we usually would follow up with those individuals.
DeMille says the individual was tested sometime in the middle of last week at the assessment center in the Nipigon District Memorial Hospital. Chief Nursing Executive Kathy Covino says even though they do have a first positive case along the North Shore, they had already taken all necessary precautions and not much is different since the test came back.
What might change just depends on the contacts and who they've been in contact with. We may see more people at the assessment center to get screened. We may have more people that have been in contact with those individuals that have questions. So that type of business, but as far as day-to-day running and the use of personal protective equipment, it won't change anything for us.
3 more positive COVID cases in Nipigon were announced Friday, a male in his 40s, a woman in her 20s, and a male under 20. All 3 were exposed through close contact to a previous case, and although the health unit doesn't say it's the other Nipigon resident, they do say traveling companions and people in the same household are regularly identified for follow-up. Corey Nordstrom, TBT News.
The number of confirmed COVID-19 cases in the Thunder Bay District has more than doubled. The health unit announced 5 more positive cases Thursday within the city, and the hospital has confirmed that at least one of those could be the first known local case of community spread. As Ryan Benazzo tells us, the next week or 2 is now critical in the fight to contain the virus.
There are now 9 confirmed COVID-19 cases in the Thunder Bay District, 8 within the city proper and another in Nipigon. This after the district health unit confirmed 5 new cases on Thursday afternoon. And later, regional hospital COVID-19 lead Dr. Stuart Kennedy added not all of the new cases are currently linked to travel.
This could be the first, sort of known cases of community spread.
The health unit is still working to confirm that. If true, that changes things at the Health Sciences Centre.
Quite significantly. We're preparing now, once we confirm the community spread from the health unit, we're preparing now that the emergency room will be a total hot zone. So when you come into the emergency department, you will be assumed that you have COVID-19.
It means staff head to toe in personal protective equipment, gloves, surgical masks, goggles, etc. And they'll be asked to conserve PPE. For example, using 1 or 2 surgical masks per day. Kennedy says the next week or 2 will be critical in determining if there's enough supply to meet demand.
If we can slow down the trajectory, we have enough supplies. If this explodes, I'll be very honest, our supply will be dwindling, and if we don't get restocked, there could be a problem.
As for bed capacity, there are currently about 260 patients in the hospital. Kennedy says they realistically could find room for about 200 more. There are 22 ICU beds, 12 of which are currently occupied, and officials are already making plans for a field hospital should the need arise.
That's in the works if we need it, but right now we're quite confident if we can actually decrease the trajectory, we should be okay, and that's what we worked for the past 3 or 4 weeks.
One confirmed COVID patient is being treated in hospital. Kennedy says that person is expected to make a full recovery and should be able to go home soon. There are 3 other presumptive cases being treated in ICU. Ryan Benazzo, TBT News.
Meanwhile, the threat of community spread is also a concern in the west part of the region. The Northwestern Health Unit says 2 new cases of COVID-19 have been identified, with neither patient traveling outside the country. Acting Medical Officer of Health, Dr. Ian Gamel, says the new cases, 1 in Dryden and 1 in Sioux Lookout, brings that region's total confirmed cases to 4, with 168 tests still pending. Both patients and their immediate contacts are currently in quarantine. Gamel says it's still very early on in the pandemic, and it's quite likely the number of cases will rise, especially now with the threat of community spread.
I want to draw your attention to the fact, though, that the positivity rate amongst the tests that have been done so far is not extremely high yet. It's just over 2%. And so what that means to me is that we are still early on, but the 2 new cases, because there was no international travel, is an indication that an early indication that we've got transmission going on in the community.
Gamel hopes with the Thunder Bay Regional Hospital soon being able to process COVID-19 tests that the results could be in their hands in the health unit within 24 hours. Politicians in the Kenora area are calling on people from Manitoba to avoid going to their cottages on Lake of the Woods during the pandemic. Kenora MP Eric Malello and his provincial colleague Greg Rickford are asking seasonal residents to stay at home at their primary residence. Last weekend, Rickford says there were just way too many Manitobans in Kenora and the surrounding area. Rickford explains it's important to avoid spreading the virus, especially in places that haven't been exposed.
Kenora, certainly as a city, Fort Francis, Dryden, we're equipped to handle surges during the summer season, but we're not equipped to handle the potential for our hospital to take on patients who would turn symptomatic and advance, as we've seen, very rapidly. And the public health risk, of course, is obvious.
Manitoba has already set up checkpoints at their borders with orders to anyone crossing them that they must self-isolate for 14 days. Rickford is pressing the federal government to announce nationwide measures for traveling within the country. A Scriber murder case dating back over 13 years may finally be solved. OPP have arrested a man and charged him with murder in the death of a woman in November 2006. 42-year-old Janine St. Jean was found dead at her residence on Queen Street in Scriber. An anonymous 911 call led police to her body. OPP said she was last seen in the company of 2 men, but no one was ever arrested. This week, OPP announced that 44-year-old Nicholas Stasela has been charged with second-degree murder in connection with St. Jean's death. The longtime Terrace Bay resident was living in Scriber. Detective Inspector Daryl Seguin says the OPP is committed to resolving this and other outstanding violent crimes in the Northwest region. OPP in Kenora have arrested and charged a 62-year-old male for offenses involving a child. The man was arrested last Sunday and faces 3 charges: communicating with a person under the age of 18 for the purpose of obtaining sexual services, sexual exploitation, and luring a person under the age of 18 years by means of telecommunications. They're scheduled to appear in court on June 11th. No further information will be released as a publication ban has been put on the case. After a successful few months, construction of the east-west tie has come almost to a halt due to multiple factors. The project, which will create a brand new transmission line from Thunder Bay to Wawa, is dealing with the effects of both COVID-19 and the spring thaw. Marathon Mayor Rick Dumas says the warmer weather was expected, but the threat posed by the virus, especially in work camps, prompted the contractor to move up the timeline for the shutdown. Marathon is one site of many work camps along the 450-kilometer project, which are, as of this week, virtually empty. But Damas says smaller aspects of the project will continue.
So there are some essential workers still here in town, ones who are living in apartments and such, that they are going to stay on, and they're still going to have some crews out on the line. So it's not shut down completely, but the camp is shut down and will not be operating until at least May 4th now and going forward. We as know, we shut down everything May 4th, so we'll go forward from there after that.
The $767 million project is expected to be completed and operational by the end of next year. A long-standing issue at a Northern First Nation is about to be addressed. Leaders in Grassy Narrows say they've signed an agreement with the federal government to construct a $19.5 million mercury poisoning treatment home. Chief Rudy Turtle posted this picture to Facebook as he announced the new 24-bed care facility for his community. Members of Grassy Narrows have dealt with health issues related to mercury poisoning for nearly 50 years. The problem began on the Wabigoon River at the Dryden Mill when containers of mercury were disposed into the water system that led to the First Nation. Kenora MP Eric Malello applauds the agreement, saying he's relieved that those suffering the devastating effects of mercury poisoning will soon be able to access support close to home. One of the partner companies involved in Greenstone Gold is attempting to have the other partner bought out. This following a dispute over whether to move ahead with the Hard Rock Mine project. Premier Gold Mines has offered to buy out the remaining 50% interest of the Greenstone Gold Mines partnership from Centerra Gold for $205 million US. The offer comes months after Centerra filed a statement of claim, arguing that the Hard Rock project's 2019 update should not be considered a feasibility study. Premier says it's working with another company which has the financial capacity to both acquire Centerra's 50% interest and fund the Hard Rock Mine's construction. The proposed mine is located on the south edge of the town of Geraldton and is expected to create almost 1,500 jobs. The mine is estimated to have a lifespan of 15 years. When we come back, officials with hospitals along the North Shore provide an update on their preparedness for COVID-19.
Hopefully only a once-in-a-lifetime challenge that we'll be facing.
Area hospitals have been bracing for the arrival of COVID-19 in the region, and now with the first case outside of Thunder Bay confirmed, those facilities are ramping up their control procedures and screening practices. Despite those efforts, hospitals will still have a hard battle on their hands. Adam Riley has the details.
We're feeling quite confident that we are prepared as best as we can be prepared. This is hopefully only a once-in-a-lifetime challenge that we'll be facing.
That's the outlook North of Superior Health Group CEO Adam Brown has now that COVID-19 in the district is a reality. His agency is charged with not just the operation of both of the hospitals in Marathon and Terrace Bay, but also their respective long-term care facilities, Peninsula Manor and Wilkes Terrace. But despite the virus's presence in the region, hospital operations continue to run.
People are still having heart attacks and other broken bones and other healthcare issues that we have to service, and so our buildings are open to those emergencies, of course. We have, like all of our peers in Canada, in fact, have downsized our essential services, so we've shut down our cataract and our colonoscopy programs, for example. Our physiotherapy services have been scaled back.
However, despite scaling back, Brown says both hospitals are still limited in resources and neither have specialists or respiratory technologists, adding they won't respirate patients for more than transportation to Thunder Bay Regional. And with COVID-19 taking its toll on long-term care facilities, Brown isn't mincing words.
And those are really difficult conversations if we're going to have them in weeks and months ahead with particularly our elderly population. The facts are very clear that a large proportion of our elderly population that is stricken with COVID will die, unfortunately.
It's a similar situation at the Nipissing District Memorial Hospital, which also has 22 long-term care beds in the facility. Chief Nursing Executive Kathy Covino says the hospital has the capacity to take care of patients, but they currently lack a ventilator.
We've ordered a ventilator a few weeks ago, so we are expecting that any time. We have also ordered 3 high oxygen flow machines as well, so that is really recommended and more appropriate for our training here at Nipissing, so that we could, give the care that's required to individuals at that level.
Covino says critical care patients will be sent to Thunder Bay Regional, and on the flip side, should the regional become overwhelmed, Ontario Health has reached out to Nipissing Memorial with a tentative agreement for them to take surge capacity patients. Adam Riley, TBT News.
Even though there is still some snow on the ground in Northern Ontario, the Ministry of Natural Resources and Forestry isn't taking any chances with forest fires. The COVID-19 situation has prompted the MNR to declare a restricted fire zone for every region of the province. All outdoor fires, including campfires and burning grass, are now banned. The Ford government's list of essential businesses includes forestry operations, but White River's sawmill has temporarily shut down due to the COVID-19 pandemic. Officials with White River Forest Products have halted operations for 2 weeks in an effort to slow the spread of COVID-19. This went into effect as of March 30th. The mill employs 200 people. White River Mayor Angelo Bizzoni says the shutdown is a sign that the virus is now starting to hit home, especially in smaller communities.
It's got an impact on our industries, our business sector, and we're hoping that it's going to be a couple of weeks, but the mill itself is closed for 2 weeks. And, and in this time, we're just asking everybody to adhere to the various notices that are out, and hopefully we can get this past us and behind us.
Bizzoni adds both the provincial and federal governments have been doing a good job in combating the virus, but he hopes the fiscal aid packages planned by both levels of government make their way to the north. Also, Hart Gold's mine north of White River has also shuttered operations until further notice. An area gold mine will soon be resuming operations now that it's completed its voluntary 14-day suspension. New Gold's Rainy River Mine announced they will be steadily ramping up operations in the coming weeks, with new safety measures being undertaken to prevent the spread of COVID-19. The company now requires all who enter its job site to be screened, with an on-site nurse available for further assessment. They've also enhanced cleaning of high-contact surfaces while promoting added hygiene measures and more thorough sanitation practices at the mine's cafeteria. New Gold is also suspending its employee shuttle bus and canceling all non-essential meetings and travel while staggering lunch breaks. An aging dam east of Thunder Bay, which was set for partial demolition, is now going to be repaired instead. Engineers who examined the Camp 43 dam on the Black Sturgeon River now say that it's at a high risk of failure. The future of the dam has been a controversial topic for years. Some believe a partial demolition could help rehabilitate native fish populations, but a number of fishing organizations say it would also reopen spawning habitat for invasive sea lamprey. The Ministry of the Environment, Conservation and Parks says the 60-year-old dam needs urgent and critical repairs. The province is now in search of a contractor to make those repairs between May and November. Coming up after the break, several mayors from the region reach out to residents concerned over COVID-19. COVID-19 has ramped up emotions, fears, and concerns of Canadians everywhere. We wanted to give the leaders of some of the smaller communities along the North Shore a chance to reach out, not only to their own residents, but people in all communities.
Hi, I'm Richard Harvey, Mayor of the Township of Nipigon.
Good day, this is Gary Nelson, Mayor of the Township of Red Rock.
Hi, I'm Rick Dumas, Mayor, Town of Marathon.
During these difficult and uncertain times, I want to just encourage the people of Nipigon to continue to self-isolate, to continue to practice social distancing. Keep yourself safe, keep yourself healthy. As a municipality, we will be making sure that all of the essential services are available, that we are taking care of those things. At the same time, our facilities, we have taken our own precautions to close facilities that do not need to be kept open. Once again, stay safe. Look forward to working together to come through this.
Last Friday, we declared March 27th at 2 p.m., I declared an emergency related to COVID-19. The declaration of emergency does not impact all operations of the Township of Red Rock, except for our recreation center, fitness center, interpretive center, library. They are completely closed. The municipality office, public works, and fire department are closed to the public, but still operational. I know that this is a harsh message, but this is a very serious disease that we are fighting. So please, anyone out there listening or watching, please keep safe and check on your neighbors, especially the elderly and loved ones.
We're taking the opportunity today to reassure our community as well as the members of the region surrounding Marathon, specifically Bitagon First Nations as well as Pic-Mobert, that Marathon and all the people working behind the scenes are looking out for your best interests. We have Marathon Council, Marathon Administration, Marathon Family Health Team, and NOSH looking out for our community and the community members within the region to make sure that everything is being taken care of to the best of our abilities to make sure you as residents of our region and Marathon are safe. So every bit of information we are sharing is out there, and we'll continue to keep everybody apprised of the situation at hand. These are trying times, and we're out here all working together, so let's continue to do that. Remember, at the end of the day, continue to keep your space, social distance, as well as wash your hands.
Thank you very much.
Thank you very much.
Thank you, and have a good day.
Much of the focus in recent weeks following the Prospectors and Developers Association of Canada conference has been on the case of COVID-19 and its impacts on attendees. There was also the support given by the Ford government for a north-south road project. In early March, Premier Doug Ford and Minister Greg Rickford signed an agreement with the leadership of Martin Falls and Webequie First Nations for a proposed northern road link, which would also connect to the Ring of Fire. The chromite deposit north of Martin Falls and east of Webequie is expected to provide billions of dollars in economic opportunity to the region. However, other communities, including Neskantaga First Nation, are not on board. While that signing was taking place, Sioux Lookout Mayor Doug Lawrence and the chief of Slate Falls First Nation, Lorraine Crane, held a separate news conference to advocate for the east-west road. Lawrence says she wants the province to be open to all options.
What we'd like to have is a rational assessment of that, a regional environmental assessment rather than a project-specific environmental assessment with a predetermined corridor. Look at all the corridors, and beyond that, look rationally at how will the north be developed with road access. And I think that's a more rational way to do it, and then look at servicing mines as they come and go in the future.
Lawrence adds communities tend to continue while mines have a finite lifespan. That's all for this edition of Northwest Newsweek. Thanks for watching, and we'll see you next time.